Ready? Okay. Hey guys, I usually don't do this, make in-home visits to women who are good looking, but it's my home and this is my wife. So this is an exception. Here's the deal though, seriously. I want to talk a little bit about injury prevention and injury maintenance. And one of the most effective things, one of the most effective tools that I have is this band. Now, I ordered this online and it's actually called a Voodoo strap. But I make these also out of like used inner tube ties. They're super easy to make. And what I love about them is that they help a ton with maintenance, they help a ton with compression, they can help alleviate pain. So Christine, who's been working out for about 4 weeks now, has developed a little bit of flare-up in her elbow, so tendonitis, what we know is like either tennis elbow, which is more on the outside, the lateral aspect, or some people get golfer's elbow, which is a little bit more on the inside, the medial aspect of the elbow. So she's complaining a little bit of some pain here when she goes into this flexion. And it's the same thing at the knee. We get the same thing at the knee. So a lot of us get elbow or knee pain, and what's happening is we're missing end range of motion. So she's unable to lock that elbow out without pain. And it's the same thing when we squat, if we don't stand all the way up, okay, or when we're running, if we don't get into full hip extension, okay, the same thing is we load this patella a ton and then we end up getting pain. This is effective for helping getting that tissue, that swelling out of the tissue. It's super effective and helping to promote healing. And the way it works is easy. Okay, I'm just going to show you. You have a wrap here, and there's really 3 things that you want to know about this wrap. Okay, number 1, first thing, here, give me your hand. Okay, first thing is, just put your hand right here. Okay, I'm going to start wrapping, and I want the wrap to be tight. So the way I do it, okay, is I start, and I'm just going to lock this wrap down, and I start like 3 or 4 fingers above the joint, okay? And that doesn't feel too tight because I'm just locking the wrap down. And then what I'm going to do is, as I go over the lateral aspect of her arm, I'm going to pull up a bunch of slack. So I overlay the band, like 50% overlay, and then here is where I get all my slack, okay? And it's going to feel uncomfortable for her, okay? And then I pick up the slack on this side. Again, lateral aspect of the arm, because this is where she has the pain. I pull the slack. It's almost like 100% tension on there. Yep. No cussing. No cussing. Okay. And then, yeah, oh, hang in there. Okay. And I'm going to just keep wrapping. Now watch. This is first rule. Okay. Heavy wrapping. Don't worry. Seriously, don't worry. I've done this before. Heavy wrapping is what you want. And look, I'm going to cover the whole joint. Okay. Again, you can see how I really go over it. And then this is rule number 2. Go over the joint. I go 3 or 4 fingers on the other side of the joint. And then I'm going to wrap back around. Okay. So I really want to stress, okay, the joint. Okay, now watch. Okay, what I'm going to do is I'm going to put a little bit of slack in this. I'm going to tuck it under, and yes, it should be shocking, and it's going to be a little bit painful. Okay, here's what's going to happen. Okay, rule number 2, this is important. Okay, once your hand goes numb or it starts to get ashy, okay, take your wrap off, or if you feel like you're going to pass out. But look, 2 minutes. 2 minutes, or until this goes numb. 2 minutes. So here's what's going to happen, okay? We're going to just kind of play around with finding these end ranges of motion. Okay, so I'm going to press into these corners here, okay, where I can get her to push into these end ranges. I would do the same thing on her knee. Okay, this is probably a little bit painful. You can show pain, okay? If you get numbness, there you go, numbness or tingling, okay, it's time to stop. Okay, but I'm really gonna, yep, she's saying she's tapping out, but I'm gonna ask for 30 more seconds. So what I'm doing is I'm taking her to these end range motions. Okay, now watch. Okay, look at the color of her hand. Look at the color of your other hand.
Oh my God.
Yep. So see how it's that ashy color? Okay, she's not getting blood flow, so it's time to take the band off. So watch. Okay, all I'm gonna do is I'll unwind this band. Now here's what I want you to turn towards the camera here. Okay, so as I unwind this band, you're going to notice, okay, not to be concerned, okay, but you'll notice like these little pops in the blood vessel, okay, no problem. But what's happening now is all this blood is flowing back into the joint, okay, which is going to promote healing, okay, and now, yep, pain-free. So now she can hit these end ranges, okay, and she's pain-free. So what we've done basically was we've compressed the tissue with the band, we've compressed the tissue, we took her to end range, we went all the way into different areas of the pocket, okay, and then we took it off and all the blood flows back and it promotes that healing. At the same time, we get that compression. She can do the exact same thing. She can wrap herself, she can hang from a bar, she can go against a wall, okay, again, like this, she can find end ranges of motion. One of the most effective healing tools that I know by far. So if you're dealing with knee pain, if you've got elbow pain, come see us. We can help you in the studio, or you can find one of these on your own and heal yourself.
Do it after workout?
You could, yeah, good point. You should do this before a workout, but if you do it before a workout, follow that rule. Numbness or tingling in the hand, numbness or tingling in the foot, band comes off, okay? You can also do it after a workout too, but either one's fine. Any other questions, points, anything?
No. Thank you.
Yep.
Feels better.
There we go.